Today we're going to talk about the meniscus. So the meniscus are two C-shaped discs that sit inside of our knee. And you'll see right here what they kind of do is twofold. It's a little disc that helps to be more of a shock absorber, like what we have in our back. We call these intervertebral discs. The other thing they do is they also cup the portions of the femur, almost like, in the bowling alley where you have those gutters, those bumpers that come up on the gutter to help keep the ball in. That's also how the meniscus works a little bit. The meniscus is very, very important to twisting motions, because when we twist, it helps kind of support it. But again, it helps with some of the shock absorption. So unfortunately, the meniscus, because we're using it and we're being very active, can actually get torn. And there's two types of tears. We can tear it what we call a radial tear, as if I just took a knife and cut this direction, or a horizontal tear where we kind of split it like two pieces of bread. Now the problem with that is these tears are very, very important to the collagen, because the fibers will run this direction along with the C, and it's almost like the metal rings around a barrel. If you ever see the old westerns that have those metal rings around the barrel, they hold in the barrel. When we lose that collagen in that area, we lose the function of the meniscus. And so sometimes we have to repair these meniscus. And if we repair the meniscus, we have to do it through what we call a knee scope or a knee arthroscopy. And what that is just simply a little incision where we put a camera in, a small incision on the other side where we put an instrument in, where we can pass some suture and be able to repair that. The downside to repairing it would be about 6 weeks of non-weight bearing, but really that's about it. Not too much downside to it. It's possible that the meniscus may not fully repair, depends on where the tear is. The further into the center of the knee, the less it potentially heals, because there's less blood supply. More to the outside of the knee, the more blood supply there is, the higher chance there is healing. And also our age matters as well. If we're younger, better blood supply, better chance of healing. If we're older, less blood supply, less chance of healing. And so your surgeon will talk with you about if repair versus what we call a partial meniscectomy, whereas we're removing that piece that's torn. Think of it as like a part of your sweater that is kind of unraveling. The best thing to do sometimes is just cut it right at where that piece is unraveling. And so that's what we would do with a meniscus. We don't remove the whole meniscus, we would just remove the part that's torn so it doesn't further get torn. There's many different types of meniscus tear. You hear a parrot beak tear, a bucket handle tear, a radial tear. There's just different ways to describe how it's torn and how we as surgeons address it. But the key thing for meniscus tears is that we would repair it with a stitch. As far as the symptoms of the meniscus tears, how you know you have them, typically is what we call mechanical symptoms. So it's anything like popping, that's painful, catching, locking, or pain with a twisting motion in the knee can often be associated with a meniscus tear. Now, frequently we'll get an MRI to better visualize the meniscus anatomy to see how and where the tear is and what the best course of action would be. We see a lot of meniscus tears in patients with arthritis, because over time that arthritic state causes the meniscus to degenerate, and you can get a tear just out of nowhere. And sometimes those tears aren't actually important, meaning that they're not very symptomatic. So if we were to get 10 people outside, none of them have any knee pain, and we got MRIs on all 10 of them, we would probably see, if they're over the age of 60, 6 out of those 10 patients would have a meniscus tear and not even know it. So just because you have a meniscus tear doesn't mean you need surgery if it's being symptomatic and affecting you. And at that point, that's where it's a good discussion to have with your physician.